Low vision care and services, vision rehabilitation. Today we're going to talk about how vision rehabilitation services help inspire people who are visually impaired to attain their goals. Before we talk in more detail about vision rehabilitation services, let's meet a few vision rehabilitation clients. Robert is a 75-year-old retired professor with vision impairment due to glaucoma that is getting progressively worse. He lives alone on the first floor of a two-family home, and his daughter lives upstairs. Robert is an avid reader and has always enjoyed going out for dinner with his former university colleagues. Lately, however, he stopped reading because he says it's too hard keeping his place, and he has lost touch with his friends because he is anxious about traveling in public. Robert feels guilty for not being more compliant with his glaucoma medication and is spending more time indoors alone watching television. His daughter has also noticed that he has a lot of bruising on his arms and legs from bumping into door jambs and furniture. Maria, an independent 62-year-old, was diagnosed several years ago with macular degeneration. She works as a receptionist at a busy insurance agency, where she enjoys the work and interaction with customers. Her greatest joy is cooking international cuisine for dinner gatherings with family and friends. At the time of her diagnosis, Maria noticed some change in her vision, but it did not affect her work or daily activities. Recently, however, at home, she set the temperature on the stove wrong several times, and once actually set off the fire alarm because of smoke. She's also having trouble at work reading and typing on the computer and taking phone messages. She is trying to hide her difficulties from her family and from her coworkers, afraid she will be let go if they realize what is going on. Maria lays awake at night worrying and feels isolated, anxious, and alone. John is 35 years old. He has type 1 diabetes, diabetic retinopathy with significant retinal hemorrhaging and scarring in both eyes, and fast-developing vision loss that cannot be improved. He has only light perception. He can tell if the lights are on or off, but cannot read print or see details, and his outdoor mobility is poor. John was forced to leave his job in advertising and move in with his parents due to finances and for help with cooking and laundry. His mother prepares and serves him meals. He has lost touch with his friends and spends most days inside listening to music. He feels embarrassed, isolated, unproductive, and depressed. He would like any kind of job to support himself and keep busy. What is vision rehabilitation? Vision rehabilitation is a variety of services that help people with vision impairment maximize independence and make the most of whatever amount or quality of vision they still have. It includes using strategies and devices to learn new ways of doing the day-to-day activities that are most affected by their vision impairment. Vision rehabilitation services may include a low vision examination, selection of low vision optical devices and assistive technology, a range of rehabilitation for daily activities, orientation and mobility instruction, and behavioral health and support services. Services are provided by a team of specially trained professionals that may be made up of an ophthalmologist or optometrist, optician, occupational therapist, physical therapist, psychologist, social worker, rehabilitation therapist, orientation and mobility specialist, vocational rehabilitation specialist, and others. Vision rehabilitation services, and how they help people like Robert, Maria, and John. Low vision examination. In a low vision examination, in addition to measuring visual acuity, the low vision doctor evaluates how well someone is able to function in daily activities and assesses their personal goals and needs. During the exam, the doctor uses specialized eye charts and unique testing techniques that differ from those used in a regular eye exam. This includes charts with much larger letters or numbers than those used in a regular eye exam. This allows the doctor to measure much lower visual acuities. There are also charts to evaluate contrast sensitivity, which is how well the client can distinguish an image from its background. An example would be letters on a page printed with very light ink versus darker ink. Glare sensitivity, color vision, and motion detection may also be evaluated. Based on the results of the examination, and after talking with the client about their goals, the low vision doctor may recommend low vision optical devices, assistive technology, and additional vision rehabilitation services. Although not every client needs help in every area, the most common rehabilitation goals involve reading, meal prep, health, safety, mobility, and adaptive technology. Low vision optical devices and assistive technology. Low vision optical devices do not bring back vision that is lost, but they can make it easier to perform certain tasks, such as reading. Devices include high-powered lenses mounted in glasses for reading and viewing objects up close, handheld and stand magnifiers that can be used for reading books, mail, and labels, telescopes for viewing objects in the distance, such as street signs, and electronic video magnifiers for writing and reading materials, such as a newspaper. Assistive technologies for vision refer to devices that draw upon advances in augmented reality, artificial intelligence, 5G connectivity, and more. These devices replace or enhance vision. Smart home technology assistance is also making many tasks easier, such as operating appliances and lights, identifying food items, and reading labels. Rehabilitation for daily activities. Rehabilitation for daily activities addresses the many tasks and skills that may be affected by vision impairment. For example, reading and writing skills may include training to use optical devices and technologies, and techniques to maximize contrast and readability of writing. Meal preparation skills may include marking appliance settings with raised dots, techniques for using knives and pouring hot liquids, and ways to use smart home technology to identify food items and operate appliances. Health and wellness approaches may include large print or audio pill organizers and adaptive medical equipment, such as talking glucose monitors to manage health conditions such as diabetes. Environmental modifications for safety and mobility may include ways to increase contrast in the living environment, installing adjustable blinds to control outdoor light and glare, and creating adequate and consistent lighting throughout the home. Communication skills may include training in adaptive technology, such as larger computer monitors and keyboards, voice output and magnification software, and training in the growing number of accessibility options on standard tablets and smartphones. Orientation and mobility. Orientation and mobility instruction teaches clients to navigate from one place to another using devices and techniques such as a long cane, guide dog, or assistive technology to avoid obstacles in the walking path. Techniques to orient to new spaces or travel routes, such as remembering the layout of a room according to a clock face, or apps that provide audio guidance to a destination. Trailing with the side of the hand along walls and landmarks to follow a route indoors, and the guide technique for walking with another person. Behavioral health and support services. Losing vision is devastating for most people and often overwhelming. They may become anxious about how their life will be impacted, angry over what is happening to them, sad or depressed, sometimes severely, frustrated over not being able to do things as well, embarrassed and self-conscious, and worried about becoming dependent on others. Behavioral health and support services help clients with any level of vision impairment who are having difficulty adjusting and coping. Low vision support groups, many of which are offered as telesupport groups, help clients realize they are not alone. They learn problem-solving and self-management skills from others going through the same thing. This helps to improve their outlook and quality of life. Clients with more severe responses or depressive symptoms may require clinical services from a behavioral health professional. This may include individual, group, and family psychotherapy and psychopharmacology to help them deal with their symptoms and develop healthy coping skills. Now that you understand more about what might be included in vision rehabilitation, we'll check back in with our clients. Robert. A low vision exam revealed that in addition to significant side vision loss, Robert had extremely reduced contrast sensitivity. Increased magnification alone was not enough for him to read, and in most cases, he needed higher contrast print. A handheld electronic magnification device with contrast control was effective in helping him to read short pieces of text, and he experimented with assistive devices that read text aloud. An orientation and mobility instructor taught Robert how to map out routes to familiar locations and to use a white cane when walking to those locations. An occupational therapist helped him increase contrast and safety in his home and taught him safe transfer techniques for bathing. Behavioral health counseling helped Robert to deal with self-blame about his vision loss and to better accept the resulting changes to his routines and abilities. Robert feels more confident navigating in and out of his home and has returned to dining with his colleagues. Maria. Her vision examination showed that Maria's dry macular degeneration had become wet and that she also started to develop a cataract. Significant loss of central vision in both eyes and a visual acuity of worse than 2200 qualified her as legally blind. A psychosocial evaluation indicated that Maria had symptoms of mild depression and severe anxiety related to her vision loss. Therapy and medication reduced her anxiety and depression, allowing her to focus on activities to improve her situation. Adaptive technology, including a larger monitor and screen reading software, plus training in accessibility features on smartphones, allowed her to perform job tasks and continue working. She also learned strategies for increasing contrast and marking appliance styles in her kitchen, as well as for using a smart home assistant to access recipes and identify food items. Maria was able to continue hosting her famous dinners. John. John's vision examination confirmed that he had little to no usable vision, so the low vision doctor recommended devices and technology that could substitute for vision, and an array of vision rehabilitation services to help him reach his goal of returning to work. A wearable device that reads text aloud was successful for him to access reading material in print and online, as well as identify landmarks to navigate by himself. He also learned to use a white cane and a variety of apps for navigation. John did well in adaptive skills training to be able to cook simple meals and do his own shopping and laundry, and he received training to use adaptive computer equipment and software. He also joined a low-vision support group for young adults where he is learning from others ideas and approaches for coping on a daily basis. John has begun applying for jobs in advertising. Today, we have taken a brief look at the difference vision rehabilitation makes in the lives of people who are visually impaired. Thank you